Hi, hello, good afternoon, everyone. This is Karen Scott. I serve as president of the Foundation for Opioid Response Efforts, and I want to welcome everyone to this afternoon's webinar, where we are really excited to share with you some information about our latest request for proposals as part of expanding our Innovation Challenge program. This afternoon, we have an hour for the webinar, until 4 o'clock Eastern time. I will just provide a little bit of a background on the foundation for those of you who are new to us, and then turn to my program director, Dr. Ken Schatzkes, who will go into some details about the RFP, and then we are aiming to leave about 30 to 40 minutes to take your questions. Please be tracking those and submitting those through the Zoom Q&A section. Go to the next slide. Just in terms of logistics, the webinar is being recorded and will be available on our website, which is on your screen, listed on your screen now, shortly after the session ends today. We'll also make the slides that we're going to use during the webinar available on our website shortly after the session as well. We are asking you to use the Q&A button, which is found at the bottom of your Zoom screen, to submit any questions that you would like Ken and myself to try to respond to during this session. A main reason for doing that is that if you see a similar question that's already in the Q&A box, please upvote it using the thumbs up button on the question so that it will go higher up on the list, and we will try to prioritize those questions of greatest interest. We will try to read as many of the questions as time permits during this session. There will also be a brief survey immediately after the webinar, and it is also always really helpful to get your feedback on the session and what is helpful to you. So let's begin. All right. So for those of you, again, that are new to the foundation, FORE was founded in 2018 as a national grant-making foundation focused on addressing the public health emergency of the opioid and overdose crisis. We've focused on inspiring and accelerating action to end the overdose crisis, and to do that through convening and supporting partners, advancing patient-centered, evidence-based solutions. We always maintain patients and people with lived experience at the focus of our work, and much of what we fund falls across these 4 broad areas of supporting work to expand professional education opportunities, payer and provider strategies, particularly around how to link people with treatment and recovery services, policy initiatives, as well as expanding public awareness. Next. We're going to be talking specifically today about our innovation program, so I will leave that for Ken, but just to give you a sense of the breadth of the work that we're supporting and involved with, we have a significant investment in projects that are focused on expanding access to treatment for very high risk and vulnerable populations. We did some work focused specifically on evaluating some of the policies during the COVID-19 pandemic. In 2022, in addition to the innovation program, we also launched a significant program on our called Family and Community-Based Prevention, very focused on children and families at high risk, and the supports for those families. And then last year, we focused on a new program, capacity building for smaller community-based organizations. Most recently, we also announced support for our first significant fellowship program, and that is actually training new public interest lawyers to work with families experiencing legal issues related to their opioid use. all of the work we fund, we also try to develop a number of resources to really make sure that what we're learning and seeing from the work that we're funding is really getting out into the public broadly, and as well as to providers and policymakers. And you can find quite a bit of that in terms of our resources on our website, as well as a lot of detail about the grants that we're funded to date. Next slide. That grantee network is now totals 105 grants that we've made to date, with a commitment and with awards totaling nearly $42 million. Again, we're a national foundation, so we do pay a lot of attention to making sure we are reaching and drawing and helping to support work in across the country in very different communities. Next. Along with that, we also are continually thinking about which are the populations that are most affected in terms of overdose mortality and morbidity, and really look for and aim to prioritize work that can support and address the needs of those populations and communities. And these are some of the populations that we've particularly focused in the work that we've supported to date, including children and youth, minority communities, rural, those involved in the criminal justice system, pregnant and parenting people. A newer area for us to explore is getting a greater understanding and focus on what's happening in older and aging adults, as well as ongoing work in American Indian and Alaska Native communities. And with that, I'm going to turn over to the specifics for this afternoon, which is the Opioid Crisis Innovation Challenge 2024 RFP, and turn it over to Dr. Schatzkes.
All right, thanks, Dr. Scott. Let's just jump in here. I'm going to try to go through these slides relatively quickly so that we have enough time to answer as many questions as possible. So again, my name is Ken Schatzkes, and I'm Program Director at the Foundation for Opioid Response Efforts. So the purpose of this RFP, and a little history here, a couple of years back, around 2021, we launched an RFP around our original innovation challenge. And at the time, we were thinking that there was, again, a lot of resources, a lot of funding has gone over the past 2 decades to addressing the opioid crisis. However, there were a number of issues that not many great solutions have come out of that work. And we thought it was a time that we could look at different ideas around the country, and specifically thinking of how can we bring new fields, new agencies, new sectors into the conversation to help better address some of these more intractable issues. At the time, we identified issues such as data, timely and actionable data, as well as reducing stigma through education as those major areas for the past innovation program. And our grantees have done incredible work around that. What we see now is a real opportunity, again, to identify some other challenges that we haven't been as successful at, and start to generate some new ideas around them. So the funding opportunity here for this, our second round of our innovation challenge, is again to generate new ideas and potential solutions to other significant problems that were identified in discussion with experts in the field as impediments to truly addressing the nation's overdose crisis. So what are we targeting this time? So we have 3 areas that we're looking for real outside the box ideas. Again, I stress this I'm going to stress this as much as I can during this webinar, but really that brings together approaches from several different fields and engages multidisciplinary cross-sector teams to solve some of these most intractable problems. So the 3 areas that were identified, and again, these were with discussions of experts in the field, with our scientific and policy advisory council, with our board. First is around innovative payment models. We know that the current payment models, they rarely align with the full range of services that are required for someone to achieve a successful health outcome. Sorry about that. Such as long-term recovery. And again, this is for whether it's medical addiction issues or non-addiction healthcare and psychosocial care that is really needed to provide those wraparound services. And current pay models don't rarely pay for those things. So projects in this focus area that we're looking for, they may include, things like creating or evaluating new payment models that improves access to all of those aspects of a patient's plan. Things that look at things such as parity around SUD care, disparities in treatment reimbursement, things like that. We were looking for projects that are focused on both public Medicaid and private payers or both, as well as projects that also address, things like payment reimbursement barriers as well, that might bleed into the other two areas. We understand that some of these are going to have some overlap. So when you apply, don't think that you're constrained to one of these areas. If you have an overlap between two of them, I would stress that as well in your applications. The second one is around workforce development. I think it's clear to the majority of people here that there's a growing shortage. There already is a massive shortage of addiction and behavioral healthcare professionals, treatment providers, social workers, peer support specialists, particularly in rural and underserved communities. So projects in this area that we're looking for, include programmatic and policy work that could help expand that workforce and as well as sustain it. Or, things around like how could we take the current workforce and deploy them in a more strategic and impactful ways. The third area we have is actually a carryover from our past innovation challenge, which is supporting the transition from treatment to recovery. So we wanted to be a little bit more clear and explicit around this area this time of what we're looking for. But much of the focus so far has been really around treatment, has been on access to treatment, and helping people get into medication-based treatment that could then lead to a more long-term recovery phase. But we understand that transitions are often a time of real increased vulnerabilities, and particularly that transition between whether you're in a residential treatment center or you're in the initial phases of treatment, and as they transition to more of that long-term recovery phase where you need those social supports around you and such. So we want to be able to find better ways to be able to help individuals that are within that transition at the time. So challenges that we're looking at that we would love to see some ideas around are, helping to find stable housing, employment, managing family reunification, things like that. So we put up here as an example recovery housing models, but I want to stress that that is not the only thing we're looking for. We're looking for those other ideas as well, that could help support people in that vulnerable transitory period. Next slide. All right, so target projects. You heard before how we stressed this idea around multidisciplinary teams here in this one. Across all of our work, though, and all of the grants that we fund, we always have patients centered at all of our solutions, and we stress a focus on health equity and reaching those diverse high-risk populations. So definitely make sure to stress that in your applications as well as Karen, pointed out the 4 Ps that we focus on, priority areas, professional education, payer and provider strategies, policy initiatives, and public awareness. The award is set at the same amount as the last innovation challenge. You may ask for up to $300,000 a year for up to 2 years. The RFP was opened about 2 weeks ago on June 14th. And the concept note stage, that first stage, will be due by August 8th, 2024, 11:59 p.m. Eastern Time. All the applications should be submitted within our grants management system, which you can find on our website. Now, the eligibility, and I already see an eligibility question in the Q&A box. Eligibility, as FORE is a private foundation, we can consider requests for specific charitable purposes from this list here. There's a little bit more information about what organizations we can grant to on our website if you just go to our grants and funding page. But this pretty much covers the gamut of what we can fund, of who we can fund. Now, just going over key dates here. So again, June 14th is when we release the RFP on the website, and August 8th is when we will be asking for that concept note. To be clear, so this is a two-stage application process. So in that case, so we ask at first for a concept note, which is a very short, structured note. Some of you may know of it as like a letter of intent or, you know, or whatever other foundations can call it. But it's very short. It's really just trying to get at, you know, what is the problem? What is the idea that you have, and how will you achieve it? We're not trying to put too much onerous work on all of you at the beginning of it. Once we get all the concept notes in on August 8th, we will be reviewing all them, and then requesting for a portion of them for a full proposal if it aligns with the RFP and we would like to see a full worked out proposal for that idea. You would hear from us by September 6th if we are requesting, and you'll hear regardless by September 6th of the status of your application. Our goal then is the latest notifications of final decisions, and that after that full proposal stage would be by the end of February in 2025. Again, here is our website for the grants and funding page. It's going to have a lot more information on our grant making process. So lastly, just some key takeaways. And again, if there's one slide here that you all should take away from this, this is it. So first, read the RFP very closely to ensure that your submissions align with one or more of those three focus areas. We really need them to fall within it, or again, it can kind of fall into a few of those areas if you think it does. Again, we prioritize work around patient-centered solutions and health equity and reaching vulnerable high-risk populations. A big portion of our innovation program is that multidisciplinary collaborations and partnerships component of it. So that must be a part of the work that you're presenting. And lastly, all the work that we do from the very beginning, we are always thinking about sustainability, longer term, broader impact, and scalability. So again, would ask you to write a little bit about that within the concept note within that question of how do you see this in the short term, but also long term, being able to help people affected by the opioid crisis. Here's our contact information. It's available within the RFP as well. So again, any eligible general inquiries, you can do the info email, programmatic questions to me, and technical questions to Lydia. I will say, and I received already some questions from people. We will do our best, but we can't necessarily respond to every body's ideas around the RFP. This is really more to be fair to other applicants as they submit their proposals as well. We really can't do that one-on-one consultation at this stage. So if you don't hear from us, or you know, or you're waiting for a response, you know, that may be a reason, but we do want to make this fair to everyone involved and all applicants as we go through these concept notes. That being said, if you have an overall question about the program and things like that, feel free to email me and I'll be happy to get an answer to you. And with that, we're going to open up for questions now. And it looks like we already have 33 questions. So Karen, our
great.
work cut out for us.
Yeah, always fun, interesting. All right, I will start off with on there are a number of people asking on the indirect costs. So private foundation, our indirect allowance is up to 10% of the direct costs. So that is that's what you can use towards your budgeting. The direct costs, again, there are a lot of questions just clarifying. So this is the budget for these projects can be up to $300,000 per year for up to 2 years. So if you are submitting a project for a 2-year period, we will look at a budget that is in total up to $600,000. Hope that answers.
All right, I think the next one. How many awards are you expecting? So as we say with all of our RFPs, there's no expectation to any specific number of awards that we will be doing. That depends quite a bit on the applications that we receive, how many we receive. as well as the quality. So at this time, we can't really give you an expected number of awards.
Okay. Will funding cover capital expenses for recovery housing? We will review and entertain a budgets for anything that are allowable expenses under the regulations for us as a private foundation. So we would consider the budget again, along with as long as it's in line with the work that's being proposed.
Right. Can an organization submit more than one application for different projects? Because of the high interest of this for this opportunity, we're requesting that an organization be the lead applicant only once for an application. So you can only apply once. That being said, if you are a partner on another application that someone else is submitting, that is something that we would be able to entertain.
Yeah, and remember with that too, we do tend to get a large number of responses on our RFPs. So but we certainly would not be able to advance more than one proposal from an organization. So if you would essentially be competing against yourself. So try to proactively identify what you think is going to be your strongest submission.
Mhm.
We fully understand that, certainly the overdose crisis has continued to evolve. Our funding does need to be addressing opioid use disorder, but we can consider things that are inclusive of opioid use disorder, but are more polysubstance.
That's the next question as well. Must new solutions focus exclusively on opioids? I think Karen covered that.
Okay.
Will community health workers meet the category requirements of being peers for workforce development? Peer support specialist was listed there as an example. Community health workers, we completely realize that they are an important part of our healthcare system. And we would be very open to seeing proposals that involve community health workers in workforce development.
Great. Okay, actually, the next question I see is there a place to find the structure for the concept note? Ken, I'll let you explain our grants manager.
Yeah, so the concept notes are all of our the application must be filled out within our grants management system. If you go onto our website, it'll have the link right in in multiple places of how to access the application. The concept note is essentially 5 questions, and they're very limited in the number of words that you can. I believe it's 50 to 100 words per question. So it's already structured there with the questions. So you'll be able to find it there. Again, we're trying not to put too much onerous work right now on you. But it should be pretty clear once you go into the application.
The next one I see are about purchasing medications. Unfortunately, the foundation's not able to pay for medications. I know that's part of the next question I see there as well. So we're not able to pay for medications, healthcare supplies, but we can, again, other costs related to supporting someone in transition from treatment to recovery would be things we could consider.
Great. Yep. And I saw you got that one done. Can you give more information about the types of applications that would be fundable in the workforce development category? Would a partnership between a nonprofit, addiction service provider, and academic partner provide scholarships? Again, we can't give specific feedback on, again, specific project ideas. However, again, it does appear that that would be something that would fit within our workforce development category. Again, you would have to see within the concept notes how strong that application would be. Can we submit 2 concept notes?
Concept mode, as we were saying earlier, again, if it's from coming from the same organization, our strong preference would be as an organization for you to identify what you think is going to be your strongest submission. We understand if it, that might be easier in a smaller organization if you're writing from a large university or hospital. We will, we will consider, we will certainly read everything that comes in terms of content notes, but we would have to choose between one of those.
Yeah, and we do read every single one of those concept
Right.
notes, just if people really are wondering, and we do receive a lot of them. Can partners or subcontractors for the project be for-profit organizations if the lead applicant is an eligible organization? Yes. So that is where, so we cannot fund directly for-profit companies, and for-profit companies cannot be the lead applicant. And to be frank, for-profit companies can't be the recipient, even as a subcontract, for the majority of the funds. However, if there is a for-profit company that is a part of your project as a subcontract, at a lower cost, then that's perfectly fine, as long, again, as it's integral to completing the project.
Sure. Can give you an example of collaborations that have been funded in the past. Sure. Again, if look at the innovation projects that are currently in our portfolio. One example would be with Dr. Desgupta at University of North Carolina. So he's obviously an academic center, but he is partnered with the North Carolina Survivors Union and other harm reduction organizations in North Carolina to launch the data tracking work that they're doing. Ken, is there another example you want to give?
A good example, I think, would be in Wisconsin. So Wisconsin, where you have the University Medical College of Wisconsin partnering with another university, a University of Wisconsin, partnering with the health department there, as well as another one of the larger peer organizations in the state. I'll give one more. Tufts University is partnering with a local EMS center, EMS organization, emergency medical service organization, as well as the county public health department, to help develop more better data systems in Tufts. So again, really thinking about those different partners that you need. Will answers to the Q&A be provided back to the group? I'm guessing I'm guessing the question is whether we'll be publishing these questions and answers. It was not our intent to do as a written document, but again, this is recorded and will be put online. So you'll be able to watch this back and listen to the questions.
In terms of a list of allowable costs, again, on our website in the grant writing resource section, you will see some more detail about what we are and are not allowed to fund. So that should be help in responding to that question.
Does funding include staffing for the project as well? Yes, we were able to fund staff salaries on the project. Again, we ask for a percentage of FTE of how much that staff member will be working on it, but it is an allowable cost. Yes.
Is there a matching component? We are always happy to have co-funders on our projects and to know that there are those partnerships, but we're not requiring that for this particular RFP.
Yeah. What deliverables are expected for this opportunity? So that is, one depends on the project, but a major component of the full proposal stage is developing milestones and setting deliverables of what, and this is set by the applicant. We really let the applicants look at the project and see what is feasible, what that they think they can accomplish. So there's no, I would say, deliverables that is a standardized set that we need to see across all projects. It's very project dependent.
Okay. Upvoting is a continuous process. So individuals are notified on this, where our timeline is to notify people by the 6th of September. If we would like to see a full proposal based on the concept note, we then, as we've done with all our other RFPs, ask for give just about 4 weeks or a little over 4 weeks, and we ask for sorry, it's 4 weeks between the last concept note and
Yeah.
asking for the full proposals. And I see that we don't have the due date for the full proposal, actually.
Nah, we don't have the date for the full proposal at the moment, but generally we give around four weeks
Six
at that
weeks.
point
Yeah.
because it depends on when the applicant will know. It's staggered essentially of when the applicant is let know about the full proposal.
Okay. We'll
But
update
generally it's
that
about
on the
4 weeks.
website, though.
Yeah,
Yeah.
I can put that on there. Yeah.
Yeah. Our goal
Um,
is to, and then related to that in terms of timeline, our goal is to ideally make the selections and take our recommendations to our board next February. And so projects potentially could start as early as March 2025. But we at that point would work with the applicant in terms of what's a start date that makes sense.
yeah. It's braided funding allowed, so therefore can an agency apply if they are receiving similar funding from a different source? It certainly doesn't preclude you from from competing for things. However, we do take into account, obviously, we're as a national foundation, we're trying to spread our resources and to help as many people as possible. So it'd be, quite dependent on what that braided funding is being presented as, how much of it is. But again, we would just to keep in mind, we are trying to get to as many people as possible.
Right, so financial audit required to apply. Financial audit is certainly our strong preference. But if you're an organization that does not have an audit, there are alternative financial documents that we can have you submit instead, but it would either have to be an audit or some alternative documents in terms of operating budgets, etc.
Would an innovative payment model project need to be implemented, or can it be presented as a possible idea? Is a pilot sufficient? A pilot would be very sufficient. Again, we understand this is an innovation challenge. Things are going to be pretty early, regarding the things that are going to be presented. So I wouldn't expect things to be fully implemented.
Mhm.
What we're seeing, at least the things we're going to be seeing in here. So that's perfectly fine.
Yeah, okay. And I think it's a similar question on the next one about the workforce area. Again, we would be open to reading concept notes about formative early work,
Yeah.
not necessarily full implementation needed.
Next one. Is there any sobriety or SUD diagnosis requirement for this funding, or can it be used for people who use drugs harm reduction? Again, we would have to see quite a bit of what the project is being presented. But I would say all of those groups would fit within this area.
Yeah. Okay, and again, we're not able to use the funds for purchase of medications. That includes Narcan.
Yeah.
We do often try to connect our grantees, harm reduction organizations who are grantees, with other organizations who can provide the medication.
Well, but there was a few of those, so we'll get rid of them.
Yeah,
Okay, so do provider incentives qualify as an innovative payment model? Yes, if it's within the model and that's the innovation that leads to better results, then sure, that works.
Mhm. Yes, could you submit an application that focuses on more than one of these categories? Yes, we'd be really interested in ideas along those lines. We do see that they are complementary to each other.
Can you elaborate on how projects should incorporate a focus on health equity and reaching high-risk populations? So I mean, I can't give you an example of what a project would look like. I mean, that's what we're looking for all of you. But it's things such as we know that African Americans have a lower likelihood of being able to access medications for opioid use disorder. So, and at the same time, we know that African American males over the age of 55 are one of the highest rising have the highest number of rising overdoses as well. So that's how we would, ask you to think about it. What are those different ways that we can help with that, be a little bit more equitable with the way that we approach these things, and as well as reach those high-risk populations that Karen, put out, children. We call out in the RFP quite a bit around two populations specifically, elder populations, as well as children and youth. So just ways to think about that.
Thanks, Ken. Okay, is grant money provided in total, or is it spent an invoice for reimbursement? So we work with the grantee to divide up. So say if the total amount of the grant is 600,000 over 2 years, our payments will be every 6 months, based on receiving a progress report, the grant making the progress that had been identified in the beginning, and an updated budget on what's actually been spent. So so the payments get then dispersed following that review with the program team.
If the latest notification time is February 25, does that mean there will be earlier notifications should our project timeline align with the February timing? Most likely that would be the case. So the latest notification, most likely there will not be earlier notifications. However, that's why we put the subject to change. Things may evolve over time. But I would have the expectation that projects would start after February.
Will projects that provide immediate support to early recovery patients qualify for the transition from treatment to long-term recovery focus? Yes, that's one of the areas that we have really heard can be a significant gap and significant risk point in terms of that transition from perhaps intensive supports to much less support and having to navigate a number of potential social challenges as well as healthcare challenges. So yeah.
You will notify applicants no later than February 28th. How quickly would you expect the project to be up and running? That's up, that's a discussion through the full proposal phase of when it would be feasible for the project to start. Ideally we would like it to get started as soon as possible in March. But again, that's going to be on a case-by-case basis.
Okay. Let's see. In terms of where FORE receives our funding, we're a national private foundation. So the funds that we have for providing grants each year are based on earnings from our endowment.
Great. Right. Would the workforce piece include working on workforce retention? Absolutely. Yes. And then I could just do the next one. Would funding staff through a registered apprenticeship model be applicable? Yes. So, again, it's going to be very dependent on the actual application, but it does seem to fit within our workforce development call.
And in the application, it only allows you to select one area of focus. You can just include in your description of the project a more comprehensive description of the areas of focus.
Yeah, we ask that you leave one because that helps us organize as well through the application process. But just you can state it within the actual concept note, that it's across two areas, or we can deduce as well since we're aware of the categories. Clarifying, I didn't understand. The grant is a reimbursing fund, or you distribute a payment at the beginning of the grant to start the program. So payments are done on a schedule. But once the grant agreement is signed, then the first payment goes out. Generally for us according to the schedule, for us to release the next payments, we generally like to see that most of the dispersed payments already have been spent before we give out the next payment. So it's not a disbursement per se, but it's the initial funds go out at grant agreement signing.
Right. Again, and then with that, they're divided across the time period, but the
Mhm.
first one does go out in the beginning so you can get the work started.
Yeah.
And subcontracts are allowable.
Yes.
Okay. Um, Other unallowables that the funds cannot be used for, in terms of specific items, the again, the medication, healthcare supplies. In addition to that are the standard things that private foundation funds can't be used for, such as lobbying, electioneering, providing funding to like for an individual, in an individual rather than a grant to an organization.
Mm-hmm. And I'll just add, because I know many of you may have applied for a community-based organizations RFP. So generally we don't fund general operating support. And for a CBO program that we decided to do something a little bit different and allow for general operating support there. This opportunity is a little bit different. We're looking for more specific projects and the funds going towards those specific work. So just want to be clear about that.
Okay. And I think yes, there was a question about
Yes.
community workers, community health workers, training would certainly fall under the workforce section.
Could this funding support contingency management for clients involved? Again, if it's able to fit within our focus areas, as well as, again, a focus on the opioid crisis, with the understanding that we know that many of the overdoses are happening right now around methamphetamine mixed with fentanyl. We can see how we can see, once the concept note in is, whether that fits into the program.
Mentioned you accept proposals related to policy initiatives. Whoop, I'm gonna go with that one since I started
Okay.
reading it.
Yeah.
Uh, yeah, so types of things we fund during related to policy are all included in what you've listed here. And the question, we have fund policy research. Again, if you look at our website, you'll see current work that we're supporting at RAND. We have supported other policy research at Urban Institute, as well as other academic institutions. We have also done educational sessions, briefings for state and federal policymakers. So all of that is certainly within possibility.
Yeah. For workforce development funding priority, are you only interested in addiction and behavioral healthcare workforce, or are you also open to dental, medical, primary care provider workforce? I believe we're open to really anyone, any part of the workforce that wants to care for people with opioid and substance use disorder. We know that primary care is a place that many do go for their medications, for their treatment. So again, I think it's up to you to make the case as to why that would be an innovative way to approach it, depending on what professionals you're focused on.
Is there incentive to apply early? Well, the funds we're at. Now, we will read all concept notes and then all requested full proposals and evaluate the full set before making our final selections.
Definitely.
From our perspective, it would be great if everybody doesn't wait until midnight on August 8th, so we can get started on them, but we will read everything before we make decisions.
All right, it's transportation and allowable costs. Yes, absolutely. Again, it'll be up to you to make the case why it's important, obviously, even though we understand why transportation is so important for this population.
Okay, for university submits 2 concept notes for separate projects. Again, as we said earlier, it won't take you out of the running. We will read them where possible. And I know it's maybe less possible in a large university, but prioritize what you think is going to be the best fit.
Can we please have a list of the 5 questions in the concept note without creating an account in the online system? We can publish that online and put that up there. That's not a problem. And put it up on our website after this.
Okay, the reporting requirements for the grant, broadly, for every single grant that we do, we request a written progress report and update on the budget every 6 months. The specifics of what goes into that progress report is going to be based on what is submitted in the proposal in terms of what the milestones and the objectives and the products are, and then we're going to be continually discussing with you whether those are being reached.
It looks like someone put the questions in the chat, so thank you for that. Since the process of treatment and recovery are not always linear, but often include some toggling back and forth, definition would include innovations to help vulnerable people re-access treatment. Absolutely. I think it's, again, we understand that this is a vulnerable transition period. It could trigger a return to use. So we understand that opioid use disorder can be a relapsing disease. So yeah, I would hope that that would be a component of the program that are being presented. Yeah.
For detail on the structure of the full proposal, number of pages, sure. Again, we try to keep these within or at a reasonable length, not too burdensome. A full written proposal for us is generally around 8 to 10 pages. And includes a background section describing the significant importance of the project, a strategy, approach, objectives, deliverables, as well as budget and project management.
Yeah, and just these are not like NIDA proposals. We very much understand everyone's very busy, and we try to streamline the applications as much as possible. So if you do get the full proposal stage, I believe you'll see that built in. Okay, next question. Is support given to existing SUD program service expansion, or does it have to be an new innovative program? Either or. I think that whether it's something that's just starting up or it's being added on to an existing program, I think both would be eligible. Both would be fine.
Does co-location in less typical settings count as multidisciplinary, stationing peers in hospital trauma surgery departments due to overlap between gun violence and opioid use? Yes, that sounds like that would fit within the multidisciplinary or across different across SUD, peer recovery, and trauma.
Yeah. What would the contingency management cap be? I cannot give you an answer to that one. Again, I think it very much depends on the proposal, and I think a part of that proposal is you presenting us what you think it needs to be. And then we would have a discussion on it. So right now, I can't give you an answer to that.
Yeah. Okay, could a partnership with complementary healthcare providers like acupuncturists and yoga teachers providing direct services for patients at a this is specific. Again, without trying to workshop a project, I would say in terms of the innovative payer and provider strategies, what we're looking for specifically in this RFP are innovation around payment models. So if you were providing all those services in one place, what are the policy and potential innovations or strategies that could be implemented or tested to determine how to pay for those services over time.
Right. Is there a requirement for any number of partners that must commit to the proposal with you? Or can you apply as an individual entity? So at the concept note stage, you can apply as an individual entity and list those potential partners. But at the full proposal stage, one of the components is letters of support, and we would strong applications will have letters of support from the partners that they're naming in their application. Just putting that out there.
Yeah, I think we've covered the number of concepts from
Concepts, yeah.
In terms of plans for releasing RFPs for around other programs, I would say stay tuned. Not this summer. But it's possible that between the end of this calendar year and early next, we will be ready to do the next one.
Yeah. I'm going to go down to this one. Our pilot projects for innovative multidisciplinary service delivery models with robust evaluation to back up cost effectiveness fundable via this RFP. Yes, yes. A part of it is, if you would look at the application, it's not just implementing and exploring, but it's also evaluating. So, if there is, a strong evaluation project that's around the cost effectiveness, I think that would fit within this.
Yeah, we're not able to cover to use the funds for medication or healthcare supplies. Generally, we do have grantees who are harm reduction organizations. We are happy for them to use our funds for anything else that's needed, and often for the staff, but not that.
Um,
Or
I'm looking at this faith-based projects accepted. So we don't fund religious congregations or religious organizations. However, um, I can give an example of a faith-based project that did fit into ours. We funded the Agency for Substance Abuse Prevention. I mean, our last innovation challenge to focus on helping training faith-based leaders across Alabama and for them to become faith-based support specialists, essentially giving them evidence-based information around opioid use disorder, allowing them to know where they could be directing their congregants that come to them for help in their community, the resources in their community. So that is an example of a quote unquote, faith-based project that we've been able to fund. However, we do not fund religious congregations for religious activities.
are capital costs allowable? If your budget would include capital costs in order to address one of those three areas, and achieve specific outcomes, then we're willing to look at that. I think we generally find that our grant funds are not at a high enough level that that they really fit with the capital costs, but as part of a budget, part of a plan, we could consider it.
Hmm. Is there TA throughout the funding period? So I think if you ask any of our four grantees, while I don't know if I would call it, formal technical assistance, we are always an ear, and here to brainstorm with our grantees through any challenges that they have. Throughout the grant, we have regular calls scheduled, at least 4 times, 5 times a year, as well as reports. But between that, grantees know they can always call us and talk through other issues. And it also allows us, again, we have as a national foundation, we have a pretty broad view of the different people working on different things all around the country. So if we're able to connect one grantee with another that maybe to help solve a solution, we view that as our role as well too. So I think that is the TA that we are able to provide.
I know we're getting close to time, so I was
That's
just
right.
scrolling through to
If there's any that we haven't answered.
regarding payment solutions in terms of the uninsured, what we're looking for here would be innovative ideas on on models for being able to provide services to the uninsured. So we're not so much able to in this to just directly just use dollars one-on-one just to pay for the care for uninsured. We're looking for what some of those broader policy models, initiatives could be to better support the uninsured population.
Hmm. See one here. Can medical legal partnerships apply, or should we focus on the new Equal Justice Works Fellow program? So again, as a national foundation trying to put our, hands into a lot of different areas, you're more likely going to be successful to go through the Equal Justice Work Fellow Program. If it is, really just establishing a medical legal partnership. However, if it is trying to do things in a little bit more innovative way, when you think around payment models or workforce development, and you think that it is standalone and a little bit different than our Equal Justice Works Fellowship, then by all means apply and we can see, if it passes muster.
Can actually, on the next one, the letters of support be included in the concept note? We would certainly want to know, and it would strengthen your concept note to know that you can identify partners
Yes.
in the concept note. But I don't know that we need the actual letters as part of the concept note.
No, letter of support and collaboration and all of those, the due diligence documents and things like that, are only requested at the full proposal stage. The only thing that you need to fill out on the first stage is those 5 questions, concept notes, as well as contact information. That's all we're requesting at the first stage.
Yeah, right. And can a nonprofit organization include a for-profit? Again, I think we covered this earlier in the discussion. So our grant can only go to a nonprofit. You can have a subcontract to a for-profit, but the subcontract cannot be the largest part of the grant. So we can't give you a grant for 300,000 and then 200 of that or 250 of that goes to the for-profit.
Mhm. Will any priority be given? Is this our last one, I guess? Will any priority be given to previous grant awardees? No, I would say it's actually probably the opposite. We've already told many of our grantees, again, trying to spread out and bring more people into the FORE family, that we were looking for new organizations to fund and partner with. I would definitely say that current grantees and past grantees don't have priority. Yes. You want to take the last one, Karen?
Okay, do
Yeah.
we fund existing programs that are in direct alignment with what you want to achieve? Sure, we're looking for, again, the best fits with the description in this RFP, which is around what are these really difficult, challenging areas of addressing and reducing overdose, opioid use and overdose, and that may be through work of existing programs as well as expanding that in new ways. And I think that's what we have time for
I think
today.
that's it for today. We answered 106, so I think we did pretty good.
I want to thank everyone for your active interest and participation. These are always really helpful for us as well to hear what what people are already starting to think about and where we can continue to clarify the information that we put out. So I think we have a couple of notes on things that we will try to update on our website.
Mhm.
And again, thank you for your interest, Ken.
Yep. No, thank you everyone for the insightful questions. Again, you have all of our contact information. And if you have any technical problems, issues doing the application, please reach out to Lydia or email the info inbox. But really excited to see all of your
We
proposals.
are. We look forward to getting the concept notes from you. Thank
Absolutely.
you. Have a
Thank
good
you.
afternoon.
Have a great day, everyone.